HESC 114, Intro to Pharmacology, Chapter 2, Drug Testing, Drug Forms, and Drug Measurements. The learning objectives for this chapter, they can be found at the start of Chapter 2. Drug Testing and Legislation. Before being available for patient use, all drugs must be tested to be sure they're safe and effective. The process starts within a laboratory setting, usually by testing drugs that are in vitro. In vitro means in a test tube. After completing those laboratory tests, they move on to testing in humans. First, they'll go to testing in animals, make sure it's relatively safe in an animal, and then they'll go on to the human trials. Now, with animal testing, we're going to look at some of the side effects, toxic effects, addictions, fetal deformities, and carcinogenic properties. Now, if it passes reasonably with animal testing, they will go on and create a investigational new drug application and submit that to the FDA asking for approval to be tested on humans. It will show the information from the animal studies, shows not an undue risk to humans, and it'll give information on chemistry and manufacturing of the drugs. So the chemical animal testing is basically referred to as the preclinical trials. And this process takes on average 6.5 years, and they will go through about 5,000 different compounds. Now, to go on to the clinical trials, before we do that, I'm going to review some terminology with you. So, an investigational drug is just that. The FDA has approved for them to do scientific studies, and they're going to review this. There's several stages to the clinical trials that are part of that investigational drug. There's actually going to be an area in a hospital or a clinic that is responsible for coordinating the use of an investigational drug. Investigational drugs are kept separate from the regular drug inventory, and there is an approval process within the facility, and the governing area is known as the IRB, or the Investigational Review Board. And then they approve it. A doctor will oversee the study, coordinate it. The pharmacy is usually the ones that dispense the medications and records all of the documentation. Now, the term pharmacodynamics is a term that means the drug's effect. So pharma, drug, dynamics, change, or the effect of the drug. So when we look at pharmacodynamics, it describes the mechanism of action, how the drug produces the effect. And then we determine, is it desirable or undesirable? And we also look at how much of the dose and how long it takes. There are some calculations that will be involved. We look at a frequency distribution curve. This helps us to determine how much of a dose over what period of time gives the best outcomes. We sometimes refer to this as the time response or dose response curves. Then we also have the half-life of the drug. This is a little weird when we talk about it because you would think scientifically it's linear, and it's not. The term half-life means the time it takes for half of the drug present in the blood to be diminished by half. So it's actually kind of a step-down process. So when you go through your first half-life, let's say it's 24 hours, one day, the end of the first day, there's only 50% of the drug left. Now, when we go on to day 2, there's going to be 25% of the drug left. So you would think, oh, if the half-life is, one day, half gone after day 1, the other half gone after day 2. But that's not how half-life works. It's half of what is left. So first day, you get down to 50. Second day, you get down to 25. We cut that in half. Third day, we get down another half. That would be 12.5, and so on and so forth. So for most drugs, it's going to take approximately 6 half-lives for the drug to be diminished enough in the bloodstream not to have an impact on other drugs or have a reaction side effects with that. Now, it may no longer be effective in a therapeutic use long before that clearance area. Now, therapeutic index is a margin of safety. We use some other terms. We can use therapeutic window, dosing index, dosing window. So there's some interchangeable terms there, but that's the range at which the drug is safe. And the larger the dose variation, the safer the drug is. So if there's a small area between the therapeutic effect and then the toxicity, it's going to be a narrow therapeutic index drug, which means that there's not a lot of wiggle room with that dose, where then it could potentially become not safe. The last term that I'm going over is the term placebo. When we're doing clinical trials, at least probably by the last stage, they're going to do what's known as a double-blind study, where they're going to give some people a placebo. Now, in the true definition of the word placebo, it's basically a sugar pill. It has no therapeutic index. Now, in the earlier stages, when they're doing a double-blind study, they're not necessarily going to use a placebo, because in the second phase, we actually are going to give the medication to people who have some kind of condition or disease, and we don't not want to give them medicine because maybe it could be harmful to them. So we might keep them on something they're already taking. They're not going to know. They don't know if they're taking the drug under evaluation or if they're taking something they know that will keep it being beneficial. The placebo stage is actually usually in the first stage when we're dealing with human, healthy people. These are the people that are going to help us determine if the drug has side effects. So we're going to give half of the people the actual drug, and we're going to give half of the people the placebo, and then we're going to compare the results. So on the next slide, the steps to the clinical trial. So these are considered to be the human trials. So after we've gone through about 6 years, 6.5, 7 years with the lab research, and they've done their investigational new drug application, we're going to move on to stage 1 of the human trials. Now, a couple of things. With the clinical trials, we started with 5,000 compounds. Only about 5 actually make it to the clinical trials. So that's part of the reason that drugs are so expensive. Time, money, research, all sorts of things in there. Now, before we involve human patients, they sign what's known as an informed consent. Especially in that phase 1 trial, we're going to take healthy people. We're going to have about 10 to 100 healthy volunteers, and that trial usually lasts for about 1.5 years. Now, we want them to know, hey, you might have some weird side effects. You know, your hair might fall out, or you might have diarrhea. We don't know yet 100%. We can base some of it on the lab results from the animal studies, but we're not going to know until we put it in a human. So they need to know what's going on. So that's an informed consent. We never use test subjects that are not aware of what's going on. Historically, there's been some stuff on that, and they definitely did that, especially military and some other areas, but not today. That's just not how we do it. Now, in the phase 2, that's going to last 2 years approximately, and they're going to use patients who actually have a disease or disorder, and it's going to be about 50 to 500 patients. And what we're going to do there is we're going to determine the therapeutic effect. So these people already have a condition or disease, and we're going to see how this drug is going to help with that. We need to determine that it's actually going to be more beneficial than anything that's currently available. So I'm going back up here. I hit forward, and I didn't quite hit all of the points on that first clinical trial. With those healthy volunteers, somebody who doesn't have a disease or condition, we're looking at where is that safe dose range? And then, like I said, what are those side effects? So then on to the phase 2. So here we're about 3+ years invested after, so now we're at 10. Now, prior to the human trials with that investigational new drug application, the company will generally put in for their patent on the drug so that they will be the only manufacturer once it is cleared. So when it talks about patent terms, the clock's already ticking before the drug even makes it to market. Now, the last phase of the human trials, official phase, is phase 3. And in phase 3, that's going to take another 3 years. So now we're at about 6.5, plus the lab trials. So now we're at like 12, 13 years of investment this drug company has put into it. For the last phase, we're going to use more patients. We're going to use between 100 and 1,000. And what we're going to do is, this is where a double-blind study will go. They're going to check the right dose, the route of administration, and the frequency. Now, the last phase is not part of the clinical trial, but it is sometimes considered the 4th phase. That's marketing and release. We also refer to that as post-marketing surveillance. So 13 years, actually 6 years, 7 years in patients, that might not be enough time to know long-term effects for a drug. So it may take 15 or 20 before we really see some of these long-term effects. So post-marketing surveillance is going to help us determine that. A few years ago, they pulled the drug ranitidine from the market. It used to be known by the brand name Zantac, not to be confused with the one that's still available called Zantac 360. That's a different generic drug. We'll talk more about generic and trade names in a bit. But with the marketing and release, the post-marketing surveillance, what they found was people who used ranitidine for a long period of time actually started getting cancer. And that drug had been out since late 70s, early 80s, and they just pulled it from the market about 4 years ago. So it really does take time. So they're going to track that long term. Now, when it comes to the drug approval process, like I was saying, we've got an experimental group and a control group. So the control group is the one that's getting that placebo or getting that drug that we know actually works. And then the experimental group is going to get that investigational new drug. The patients or the test subjects don't know which group they're in. And that's why they call it a blind study. Now, going forward, a couple more terms. With expanded access, this is a term to give use of the drug to people that need it really quickly. It's also known as compassionate use. So these are kind of similar terms. We kind of did this with COVID vaccine to try to help prevent the spread of COVID. We had a compassionate use or an expanded access. The trials weren't completely over, but the other hand of that was they'd been building this vaccine base for decades. So it was kind of a formality. Now, compassionate use, your book talks about the use of AZT, zidovudine, which was used for HIV because thousands and thousands of people were dying without use of that drug. And then when they used it, they found that only one person died that was given the drug. So that was compassionate use. So it's kind of allowing the drug to be used before it's fully approved. Now, the completion of the clinical trials, once the trials, stage 3 has been complete, the company is going to do a new drug application, and this has to be approved by the FDA. It's going to take at least a year and a half to go through all of the documents. And your book talks about how it could be an 18-wheeler trailer full of documents, and it's all highly scientific. We started with 5,000 compounds. 5 come to trial, and maybe 1 drug out of those 5 will get approved. So, doesn't always happen, and it's not always quick. Now, once a drug has been approved, the manufacturer can't make changes without coming back and doing more trials. So it's going to list the ingredients, the dosing, the processing of manufacturing, how the drug will be labeled, and how it will be packaged. Does it need to be protected from light? Things like that. Some terminology with manufacturing. I don't know that all of these, yeah, I guess. Bioequivalent, that's not just a manufacturing term, but something that use of the medication is important. Now, again, the manufacturing is overseen by the FDA. So a drug that is bioequivalent, that's for a generic drug. It has to be bio of the body equivalent in the body as the trade name drug. They have to have the same drug chemical, the same dose form, and it has to be at the same strength. Generic drugs do not have to have the same bioavailability. So how much it's going to be, the body's going to recognize it as equal, but it may not be 100% of the drug available at all times to the body in the same way. And that's partially based on the inert ingredients. Inert means the non-active component. It could be a binder, a filler, or preservative. It's something that holds the medicine together, especially when we're talking about tablets. Now, with bioavailability, for a bioequivalent, the bioavailability is the difference is going to be very minimal. So basically, the body's kind of still seeing it very similar. The only consideration is if it is a narrow therapeutic index drug or an NTI drug. So again, there's a small variation can make a big change. So when a prescriber is writing for an NTI drug, usually they will do what is a DAW, or a dispense as written, because just a small variable can affect the patient significantly. So drugs like levothyroxine, which is a synthetic form of thyroid hormone, there's different brand names. There's Synthroid, there's Levoxyl, there's Levothyroid, and then there's generic levothyroxine that's available. And there's many different manufacturers. It could be a Mylan generic, it could be a pharma generic, it could be Watson generic. I'm just throwing out some of the different generic manufacturer names. I don't have a list in front of me to know if they make levothyroxine or not. I know Mylan does. But if the patient is stabilized on a specific generic, they have to stay with that manufacturer because of that NTI. Now, I like to talk about this kind of in non-pharmacy or non-pharmaceutical pharmacology terms. Think about chocolate chip cookies, right? Who doesn't like a chocolate chip cookie? There's lots of different brands of chocolate chip cookie, but they're all basically the same. They have flour, sugar, chocolate chips. Now let's think about some different chocolate chip cookies. Chips Ahoy brand name versus the Walmart brand. They're pretty much the same. They're a chocolate chip cookie. They taste very similar. But Pepperidge Farm Sausalito chocolate chip cookie is very different due to the other ingredients. So Chips Ahoy and Walmart might be crunchy, where the Pepperidge Farm is soft and chewy. Now, the variance in bioavailability can have a consequential impact on the patient. If we're saying chocolate chip cookies and we've got crispy ones, maybe somebody who has some dental issues, that's not a good cookie for them. But I know it's an oversimplification, but at least hoping to give you a little bit of a picture of how things are similar but can be slightly different. Now, when it comes to packaging, to protect tablets and capsules from deteriorating due to moisture and light, we put in a desiccant. So a desiccant, the term desiccant means to dry out. So these little packs, it could be a little cylinder filled with a little gel, or it could be like a little pillow container. They're going to help absorb the moisture and keep it away from the tablets. Now, these desiccants have to be dispensed in a multi-dose stock bottle. Now, if things are individually sealed into blister packs, that is considered to be a single dose or a unit of use. So manufacturing has to be described in the whole process of how the drug is being approved by the FDA. Another thing to be considering is the labeling associated with the drug. Every drug and many over-the-counter products have an NDC number. This is a national drug code. It's basically like a catalog listing. Like if you're looking for a product, you can look it up by its number. Sometimes in retail they call that a SKU. There's a certain method to an NDC number. It's a sequence of 3 sets of numbers. Recently they've increased it from 10 to 11 numbers in total. So the first segment identifies the drug manufacturer. So down here I have some examples. So here we have propranolol, and we have a 10 milligram and a 20 milligram. This is a generic drug. It doesn't have the little copyright symbol after the name, and there's no other name on here. The hydrochloride is the salt component, or the component of propranolol. So all you really need is the propranolol. You don't need the ending part. We do see that it's listing that these are tablets, and these meet USP, United States Pharmacopoeia Standards. The different strengths, the manufacturer is Watson, and how many are in the bottle. We also see that RX only symbol or legend at the bottom. Now, if we look at the NDC number, so the first part, because this is Watson, they both have 0591. Don't ever worry about memorizing these. Manufacturers change NDC numbers, but it's built into the barcode. So that's part of that barcode technology, that safety component. Now the second part identifies the drug, the dose form, and the strength of the drug. So when we look at this, the 10 milligram is 5554, but the 20 milligram is 5555. So when this gets plugged into a computer, it would identify the correct drug. And then the last segment is the packaging. So for Watson, 10 means that it's a 1,000 count tablet bottle. All drugs that are approved have an NDC number. Now, other things that must be on a label: an expiration date. This is a manufacturer's expiration date. And then a lot number. This is a control number. If there should be something wrong with the batch that gets produced, you will need a lot number and expiration date to be able to find the medication and pull it from the shelves, and if needed, contact patients. So these are requirements by the FDA for being on a prescription label. The marketing component. Marketing is regulated by the Federal Trade Commission. Drugs were once only marketed to physicians and healthcare professionals, but now we have direct-to-consumer marketing, and it's very common. So we have a lot of patients coming in because, at the end of the commercial, ask your doctor if blah, blah, blah could be good for you. Sometimes that causes some challenges because patients sometimes come in thinking they know what's best for them to take and not leaving it to the healthcare professionals. Now, because of the expense of bringing the drug to market, the company that develops the drug has a period of time where they are the only person or only company allowed to sell that drug. So again, they register the name of the drug with the U.S. Patent Office to get a trademark. The patent lasts for 20 years. And because they do it while it's still in the clinical trials, they lose a little bit of time. So on average, they're going to have about 17 years of being able to sell that drug under the trade or brand name before it comes off. A couple of years ago, we had a lot of drugs that were available generic, but we've had a slowdown with that. So until drugs have been on the market for at least probably 17 years, we're not going to see generics become available. Now, the next is drug legislation. A challenge of the law is there's tons of loopholes. And we know that in a litigious society, people like to take advantage of those loopholes. So just a few, this is not like students who come into pharmacy, you're going to have to learn the laws. I'm sure in your other disciplines, you're going to have to learn your laws as they pertain, but some common ones to be aware of. The first attempt at real legislation of medication was the 1906 Pure Food and Drug Act. And this was to say that what was listed on the bottle was actually what was in the bottle. It didn't really require anything be safe or effective. It just said we can't give somebody something that is misbranded. We can't give them false information. Back then, they were still putting things like kerosene and heroin and all that kind of stuff into their medications. But it was on the bottle, so they were meeting the letter of the law. Now, in 1938, they wanted to come around and fix that a little bit. 1938 was the Food, Drug, and Cosmetic Act. This caused the formation of the FDA, the Food and Drug Administration. It required the manufacturer to prove the drug formula was safe. And part of that came about because some early anti-infective drugs, sulfonylamide, I'm not saying that right, arsphenamine, that's one. It actually had the same equivalent of antifreeze in the drug. So people died. So they said, you know what, we can't be killing them just because it's listed on the label. We need to show that it's safe. So then this started the whole clinical trial component. So now it had to be safe. But they didn't address, was it effective? It's gonna be many years before we even come up to that one. The next important legislation was 1951. This is the Durham-Humphrey Amendment. Hubert Humphrey, who was the vice president for Lyndon B. Johnson in the late 60s, he was a pharmacist and a legislator. So in 1951, this amendment passed, and it required, or it differentiated between prescription drugs and over-the-counter drugs. So it created that legend. Caution, federal law prohibits dispensing without a prescription. Now, again, 1938, they said it has to be safe, but it wasn't until 1962 they decided it also had to work. And that came about, the Kefauver-Harris Amendment. That one came about as a result of a thalidomide, a drug called thalidomide, which caused birth defects. It just, I'm not going to go into a whole bunch with that. I could go on for a whole nother lecture on laws, but these are just some of the basic laws that kind of shape pharmacy and pharmacology. Now, the next important one happens in 1970, and that's the Controlled Substance Act, also known as the CSA. And this entity created the DEA, the Drug Enforcement Agency, or Drug Enforcement Administration. This made dangerous drugs under control. So in the late 60s, we had a lot of hallucinogenic type drugs, things available that weren't being strictly controlled. So the DEA came in. They didn't get formed until 72, 73, but the Controlled Substance Act actually created tiers of restricting access to dangerous substances. So that's pretty basic on that one. Now, with the patents, like I said before, a drug patent is usually filed prior to the drug being approved. So part of the 20 years, the drug is not available for sale. It patents that trade name. So that's why it's called proprietary. Somebody owns it. Trade name is synonymous with brand name and also proprietary name. And again, that 20 years, but in real shelling time, probably about 17. The next section is talking about the different formulations for drugs. The most common is going to be a tablet. So a tablet can be abbreviated TAB or TABs. When we're transcribing prescriptions for a patient's use, we want to use full words. We do not want to use abbreviations. Medical abbreviations are sometimes also called SIG codes. The term sig is short for signa, which in Latin means use. So it gives the explanation of how to use a drug. So just in the future, as we're going through these chapters, if there's something that says transcription, we don't want abbreviations. Now, the different kinds of tablets that we have, there's a number of different kinds of tablets. So scored tablet is very common. So a scored tablet actually has these divots in it. It can be easily split pretty accurately. We're never going to be 100%, and we can get pretty close to the dose that's being given. So here are a couple examples. This one can be cut into 3 pieces. This one over here can actually be quartered. Now, if a tablet is not scored, it should not be split. Effervescent tablets, so these are tablets that you put into water and then they bubble. So like Alka-Seltzer, there's a few other things, and then you drink it down. So this isn't effervescent. We see all those bubbles rising up. That's what the term effervescent means. Then we have enteric coated tablets. So the core is where the medicine is, but there's going to be a coating on it. They almost look like candy, right? That's a risk for kids too. So this looks like it's a ketoprofen, ibuprofen. Those are things that are enteric coated. They're going to help protect the stomach. The coating on it doesn't dissolve until it gets into the intestines where there is an alkaline environment. The drug itself could be very irritating to the stomach, or the stomach might break it down and the body might not get what it needs from the drug. So we put an enteric coating on it. A caplet is actually a tablet that's shaped like a capsule. So that helps with ease of swallowing. Sometimes a large round tablet could be hard for somebody to swallow, but when you streamline it in a capsule form shape, it's a little bit easier to swallow. But a caplet is a tablet. It's not a capsule. We have slow releasing tablets. These are extended release. So there's a lot of different abbreviations that kind of indicate that it is not an immediate or a regular release medication. Here are a couple examples. We see CR for controlled release. Over here we have XR for extended release. A lot of times we don't see any score on this Cinemed over here, but we do see one on the Augmentin. The thing here, it's an antibiotic, and if everybody's ever taken an Augmentin, these are really large tablets. So sometimes they'll cut them to make them better for swallowing because it makes it a little smaller. Most often, if you have a controlled delivery, a controlled release, a CD, a CR, sometimes with the ER extended release or the LA long acting, or an SR slow release, an XL is extended length, or an XR extended release, you're not supposed to cut them. Like I said, if it's got a score, then it's going to be okay. But generally, most of your extended release or slow release tablets are not going to be cut. The next is a lozenge. If you've ever had a sore throat or a cough, maybe you've used a lozenge before. It's a hardened base of sugar and water, and it contains the drug and flavoring. They're not supposed to be swallowed whole. They're not supposed to be chewed. It's supposed to allow it to dissolve in your mouth and either absorb in your mouth or, like with a sore throat, go down into your throat. And then we have what's known as a troche. So there's 2 proper pronunciations, troche or troche. Both are correct. Now, this one looks kind of like a regular tablet, this Miselex. Miselex is actually an antifungal. We use it for people who have oral candidiasis, what's also known as trench mouth. They get a white coating in their mouth from a fungal infection. They let this dissolve in their mouth, and it works right there. Over here, we've got another troche. It almost looks like a lifesaver, right? Troches can be round like these. They can be oblong. Your book talks about them being oblong. It's got a sugar base. It will dissolve or disintegrate into the mouth, usually into like a paste that's going to cover, like with this Miselex, and slow release. Down here we have some other troches. They can even be gummy. and they're not meant to necessarily be chewed, but parked in the mouth and allowed to dissolve. So many different formulations of tablets. Now, the other common dose form orally is a capsule. So the abbreviation for capsule is going to be cap or caps. And there's two types of capsules. We have soft gelatin capsules. So these usually will contain some kind of liquid. It could be an oil or the medicine in a liquid form. This kind of looks like maybe a vitamin E capsule. This makes me think of naproxen. You don't want one of those to dissolve in your mouth because the medicine inside will burn if it dissolves before it gets down into your tummy. So soft gelatin capsules, these dissolve pretty quickly when they get into your stomach. The other is a hard gelatin capsule. So generally these are going to have two parts. You're going to have a head and you're going to have a body on the capsule, and it's going to contain the medication inside. It could be a liquid form. It's not going to be water-based because gelatin can dissolve in water, these hard shells, but it's often going to be a powder or some kind of pellet. Comes in many different sizes. The largest size is what we call a triple aught. It's 3 zeros. And then the bigger the number, the smaller the capsule. So this is showing compared to a gummy bear. Most of you know about the approximate size of a gummy bear, so that gives you some perspective. We manufacture these sometimes, or not manufacture, but compound these in the pharmacy. Now, most times capsules are not meant to be broken open. There are some exceptions, and that's something that is known or called a sprinkle. If it's a sprinkle drug, that actually means that you're supposed to break the capsule apart. Like your tablets, we can have the regular release capsule, but we can also have extended release capsules. Films are another dose form. So Suboxone, this is buprenorphine with naloxone, and they parked it on their cheek. This is known as the buccal or buccal area in the mouth, and this is a narcotic. It's used for pain. And then Belbuca, buprenorphine, again, same ingredient, just to show you some of the different packagings. These are going to come in little individual foil-based packages because can't be exposed to moisture. We don't want them to cut, tear, chew, or swallow the film. I almost think of it like it will often dissolve. It may or may not. Think of it kind of like an internal transdermal patch for the mouth. Ointments and creams. So an ointment is generally going to be a oil-based product. So it's going to be kind of greasy. It's going to be thick. It's going to bring the medication and hold it on the surface of the skin. And then a cream. So here we've got the ointment, and over here we have a cream. A cream is a water-based product, and it can absorb into the skin. So you're going to usually have an oily surface with an ointment, but the cream could actually rub into the skin. These are known as semi-solid emulsions. So an emulsion is when you're mixing two things together that don't usually mix, but we're able to keep them together. So both of these contain oil and water, but the ointment has more of the oil and the cream has more of the water. Now, another liquid type of drug is going to be a lotion. And this is applied topically. Most people are familiar with lotions. Some are a little thicker, some are a little bit more watery. They generally will absorb into the skin. When we're talking about viscosity, so the term viscosity means how thick something is. So when we're talking about that thickness or that viscosity, an ointment is the most viscous and a lotion is the least viscous. So creams are going to be a little heavier than a lotion, and then ointments are definitely much more heavy than a cream. So again, those terms. So the term aqueous, aqua means water. So aqueous means that it's watery. It has a watery base. Viscous, like I said, it's not watery, it's thick, it's syrupy. It's got consistency to it. Now, there is a drug called lidocaine, viscous lidocaine, and this is used as a topical oral. If somebody's got some mouth sores and it's hard for them to eat, they might swish this around their mouth and then spit it out, or we also use it in some other things that they actually swallow it to coat down their esophagus. So if they have sores or burning in their esophagus, we can numb that. So viscous, syrupy, thick, aqueous, watery. And then we talk about how liquid drugs can be available. And most of this is going to be for injectable type drugs. So I'm going to be backwards on this. I just realized as I'm looking at my notes on the next slide. So the first one we're going to talk about is the ampule. So an ampule is actually a slender glass container with an indented neck. So up here we have the head, the neck, and then the shoulder to the body of the glass ampule. And on this neck is actually where we will break open the ampule. When we do that, we're going to use alcohol swabs, 70% IPA alcohol. We want to clean it first, then we're going to snap the neck off it. And then we're going to need a filter needle because we don't want any potential glass shards or paint chips that could come off the ampule to get into the solution. We can't put a cap back on it, so this is considered to be a single dose container. Generally, these are not going to have any preservative in them either, so we're going to use them all up in the first try. Now, a vial, which is the most common type of container for a injectable drug, it's a small glass bottle, and the top it has an aluminum. So here it's going to have an aluminum cap on it. It's going to have this protective cap, and when that comes off, there's going to be a rubber diaphragm underneath that we're going to insert the needle through to withdraw the contents. Now, sometimes in these vials, there's powder, and sometimes it's liquid. If it's powder, we're going to have to add liquid and make it into a liquid. So kind of think like making Kool-Aid, right? You don't just dump the package of Kool-Aid into your mouth. You mix it with water before you drink it down. So vials can be single dose or they can be multiple dose. A multiple dose vial will have a preservative in it. So you really want to look at your labels because it may not be quite obvious. And especially if you're dealing with pediatric patients, many pediatric patients can't do certain types of preservatives. So we want to make sure that we're using preservative free when we're dealing with our pediatric patients. Your book continues on talking about liquid drugs, solutions that have a liquid base, generally a water base, an aqueous base. So the first one is an elixir. Elixirs are solutions that contain a drug and a water base with sugar and alcohol. So we have here in my image, I have phenobarbital elixir. This is a barbiturate. We use this often in treating seizures. Tylenol elixir can be is available as well. We do use them in pediatrics and elderly patients, mostly for people who can't swallow tablets or capsules. We do need to be aware that they can contain anywhere from 5 to 15% alcohol, which is also why elixirs could be a drug seeker's mission, or somebody who's abuses alcohol and they can't get it somewhere else. They could be drinking this because it's got a lot more than a beer does, even by weight. We need to be careful in patients who have diabetes. Most patients who have diabetes should not be drinking alcohol. The next is a syrup. So most of you are going to be familiar with that. You've had a cough. Maybe you've used cough syrups before. It's a thickened water base. It has sugar and flavorings. It doesn't have any alcohol in it. So that's the difference. Elixirs, they're usually a little bit more watery, and they also contain alcohol. But both contain sugar and water. Syrups are sweeter, they're more viscous, they're available over the And we actually even have thickening agents for people who maybe have had a stroke and they can't do water because they would choke on it. They need something thicker. Most common, think about Robitussin, cough syrup for a syrup. Sprays. Sprays are a liquid, water-based solution, or it could be alcohol-based, sprayed manually with a pump by squeezing the drug bottle. They're forced from a can like an aerosol propellant. So there's a couple different ways to use a spray. We have foot sprays. We have nasal sprays as pictured here. This is flunoxazolide nasal solution. Imitrex, which is a medication for migraines, comes as a nasal spray. And then some of the sprays actually can come in a canister for certain types of inhalers for asthma. I think of those more like hairspray type sprays or spray paint canisters. Then we have foams. So foams are also a water base, but they expand with tiny aerosol bubbles when they get spread out of the container. Contraceptive foams, Rogaine foam for hair loss. And then here we have Proctofoam, which is hydrocortisone. And this is a topical aerosol. This is Procta. It's made mostly for hemorrhoids. Foams generally will stay a little longer in an area than a liquid. And then we have tinctures. So tinctures are solutions that contain a drug and water and an alcohol base. Sometimes they're used topically, like tincture of iodine. Your book is incorrect when it states that tinctures are never taken orally, and I'm using this image to reinforce that. Tincture of opium, which is usually used when treating severe diarrhea. This is taken orally. Sometimes the book is not 100% accurate in some of the things that it notes. But a tincture, again, it's water and alcohol. There's no sugar. So the difference between an elixir and a tincture is the elixir has sugar and the tincture does not. A couple more liquids, but these are where the solution, the particle doesn't fully dissolve, but it is uniform. So when I talked a minute ago about ointments, creams, and lotions, I mentioned they were emulsions. To put it really simply, dairy milk is an emulsion. Like back in the old days before we had milk processing, if they get the milk from the cow, they let it settle and they pull the cream off the top. Well, now what they do is they mix that milk fat and everything gets spread out uniformly. You can't tell that there's fat in that milk. You don't feel little globs when you're drinking it. But we can also buy different kinds of milk, right? Whole milk, you're going to have that dispersion of the fat in there. And then we have like 2% milk. Well, that's going to have 2% milk fat. 1%, it's only going to have 1% milk fat. And then skim milk, which is more watery, doesn't have any milk fat. So as an emulsion, if we're comparing it, whole milk or even heavy cream is going to be the more viscous, the thicker, and skim milk is going to be more aqueous because of that interdispersion of those fat components. So they use the term colloidal. Some of you have taken chemistry or you're going to take chemistry. Some of you will never take chemistry. So I kind of like to address it to different levels so that it gives you different pictures. But some of the types of emulsions that we eat every day, and we don't notice, hey, these are different things mixed together to make it all uniform. That term is known as homogeneous, right? Homogenized milk means that everything is been emulsified. It's all mixed together and doesn't come apart. So mayonnaise, butter, creams, ointments, things like that. Now a gel is has very, very fine undissolved drug particles, and it's usually in a thickened water base. And again, these can vary in their viscosity. So we've become very common with these hand gels, which is why I selected this image. Due to COVID, we all use a lot of these hand gels. Some are more watery, some are a little bit thicker. If you use a gel after having a sunburn, like an aloe vera gel, right, it's usually a little thicker. but they don't feel gritty. So the suspension, it's uniform, so we're not feeling anything gritty. Now, first, those were solutions. So everything in a solution is well dispersed and kind of dissolved, so that it's not gritty. When we talk about a suspension, it's a liquid that has fine undissolved particles. And it's suspended in either water or oil. After a long time, if we let it sit, those particles will come out of that solution, and it actually will create a settling in the bottom of the container. Now, because of that, it's really important that we shake well. And if it's something that the patient is taking home, they need to know that they need to shake it well. So, unfortunately, I couldn't find a really clear picture, but this amoxicillin oral suspension, the bottle itself, sitting in the pharmacy, it's full of powder. So when the patient comes to pick up their medicine, we add the liquid. On a nursing unit, it may be an individual packet, kind of like Crystal Light or something like that, where you just take it, you put it in the dose cup, and you add the amount of water that you're supposed to add, and you stir it up, and that's the appropriate dose for the patient. Most of you at some point, maybe when you were a kid, you had an infection, you used amoxicillin. We know that it's pink, kind of bubblegummy flavor. Can be flavored in the pharmacy as well. But in the package, we store it in the powder form because it's more shelf stable. Once we add the liquid, it's not going to be as stable. Other things that come as suspensions, eye drops, ophthalmic suspensions. There's a number of different things, and we always want to make sure that we use that shake well label. Powders come in a variety of different forms. Sometimes powders are mixed into liquid, like with Metamucil. It doesn't fully dissolve. It usually makes a very thick liquid that the patient's going to then drink. This is to increase fiber. Inhalers may have powder. We call these DPIs, or dry powder inhalers. The powder is very, very small. It gets down into the lungs and gets the airways open very easily with that contact with the drugs. So we do have inhalation powders, and then we have other powder that's used in a more traditional sense and applied to the body. So Zeosorb is an antifungal. It's miconazole, and this one's for athlete's foot. The next dose form is a suppository. Suppositories are made of glycerin or cocoa butter as the vehicle or the carrier and an active drug. They are inserted into a body cavity. It could be vaginal or rectal. It could be pediatric size. If you're giving it to a kid, you don't want to use the same size an adult might use. We also have vaginal suppositories to treat vaginal infections, rectal suppositories for medications, like if somebody's vomiting and we're not going to give them an injection, we can use this. People who are in pain, that are unconscious, and then topically to treat something like hemorrhoids. The next dose form is a transdermal patch. So this is applied to the skin, and it's got a drug delivery system in it. It's going to have a backing layer that's going to prevent any of the drug coming through on the surface. It's going to have a reservoir that's going to contain the active ingredient. It's going to have an adhesive layer so that it will attach to the skin. And it's going to have a membrane where the drug is going to pass through. Now here we see it's passing through the skin. Dermis is another word for skin, as is cutaneous. So we see this is passing through the dermis and actually getting into the bloodstream. So when we're talking about transdermal patches, some are local, like they're going to help if you've got pain in that area, and some are going to be systemic, and they're going to actually absorb into the body and into the bloodstream. So an example of a systemic is a Nicoderm patch. So this is nicotine. So if somebody's trying to quit smoking, it's going to help them. Now, Nitrodur is another one. This one is also systemic. This is nitroglycerin. So if somebody has angina, they might put this patch on. Now, a lot of the patches are left on for 1 to 2 or even 7 days if we're talking some hormone patches. Nitroglycerin's an exception. They put it on for 12 hours and take it off for 12 hours. It's important when patients are changing their patches to know, take your old patch off before putting a new patch on. Sometimes they don't know that, and especially with this nitroglycerin or nicotine, they show up in the emergency room thinking they're having a heart attack. They open their shirt to put the leads on to check them, and they've got patches all over their chest or arm, and it's because they're having a drug overdose, not because they're actually having a heart attack. Other types of patches that you may be familiar with, transderm scop. This is scopolamine. If you've ever been on a cruise, you might have used this patch. It's actually a really small disc you place right behind the ear. This is an anticholinergic drug. It's similar to an antihistamine, and it helps with motion sickness. And then we also have pain relief. So fentanyl transdermal system. Duragesic. For a minute, it was escaping me. Duragesic is one of the brand names for the fentanyl transdermal. This is a generic. Mylan is the generic manufacturer. So let's look at this really quick. All right, so we've got Nicoderm. This would be a brand name. We can't really see on this label, but it's going to say nicotine here. This nicotine, it doesn't have a little trademark symbol. This is a generic. So we've got a brand name and a generic. Nitrodur, we see that little trademark symbol, so we know this is the brand name, and then underneath we have the generic name. Remember, every drug has a generic name, but not every drug has a brand name. Transderm scop, we see that trademark. Scopolamine, the generic name. Fentanyl, only one name. It's a generic. Two more to go. So a pellet, a wafer, or an insert. A drug pellet can be placed within the body or a space in a body cavity where it will slowly release the drug into the surrounding tissues. Muse is a drug pellet that a man will insert into the urethra to treat erectile dysfunction. Glidel is a chemotherapy drug. It's a wafer, and it's actually implanted into the cancerous tumor in the brain. So that's what this image is showing. They're putting a Glidel wafer into the brain. And then Lacrosert is a drug that is placed into the lower eyelid sac to treat dry eye syndrome. So it comes with special tweezers, and the patient's just going to place it into their lower eyelid. And the last dose form are gas. So gas can be inhaled. It usually works rapidly. It's also usually expelled through respiration. So it could potentially wear off fairly rapidly as well. We'll talk more about them when we talk about anesthetic drugs, but here I've got some images. This first image here on the left is a dentist office, and they're using nitrous oxide. So nitrous oxide is an exception to most of our anesthetic gases in that it doesn't put you all the way to sleep. It has some analgesic properties, and then it helps you relax. And then over here on the right, we're seeing anesthesia, full-on anesthesia in a surgical suite. It could be something like isoflurane or Suprane, where the patient's going to be completely to sleep. The next section talks about drug measurements. We're not going to be doing any math in this class. Don't worry about that. But it is important to know what measurements are, how to read them, and what are the appropriate abbreviations. Now, historically, apothecary measurements for drug doses included things called minims and drams and scruples and grains. We still sometimes use a grain, but we're all about patient safety. So mostly we are going to use drug measurements in the metric system. So we don't use the apothecary system, but we do have some carryover that rolls into household measurements, pints, quarts, gallons, pounds, things like that. Most drugs are measured in the metric system. So let's talk about that. Now, when it comes to weight, the most common measurements for weight in the metric system include kilogram, gram, milligram, and microgram. So a kilogram is abbreviated CG. This is usually the weight of the patient, unless it's pediatric. Neonates, newborn babies, they're often weighed in grams, but an adult is going to be weighed in kilograms. Now, the gram is what we call the base unit that everything else is based on. So a kilogram is bigger than a gram, and a milligram and microgram are smaller than a gram. And it's by a factor of 1,000 as we go to each level. A milligram is going to be one of our more common, and that's abbreviated mg. These are lowercase. You can do an uppercase K with a kilogram or an uppercase G for gram. Sometimes you'll see it GM. I try to avoid that because grain is GR. And keeping it simple with just a G helps us be a little bit more exacting. Now a milligram, we see here on the bottle, this is 40 milligrams. And then a microgram, right? You need a microscope. It's really small. So that is mcg for microgram. And over here, synthroid, it's 175 micrograms. Now, it's 1/1000th of a milligram. So on the bottle, it's also telling us the dose in milligrams, which is 0.175. So be looking for the units. When it says what is a unit of measure, we're looking for the abbreviation, not the amount, not the number part, but actually what is the measurement unit, the metric or unit. Now in volume, our base unit is the liter. Your standard IV bag is 1 liter of solution. It's approximately the same as a quart. And then milliliters, and a lot of what we measure is in milliliters, and milliliters is a small m with a capital L. Sometimes you'll see it a small l as well, lowercase, but liter is generally going to be a uppercase L, and milliliters is lowercase m, uppercase L. And here, this is a liquid drug. So with a liquid drug, the container, like if you buy a bottle, you're going to have how much is in the whole bottle. That's going to be the quantity. Kind of like over here, we know there's 1,000 tablets here. This is telling us that there is 1 milliliter in this bottle. Now, the strength of the drug is going to be how much of the drug is in each milliliter. So for that case, there's 50 milligrams in each milliliter of drug. So liquid drugs, you're looking for a combination. And then when you've got just a oral solid dose form, if we're wanting to know what the dose strength is, it would be 175 micrograms per tablet. But most often we're just going to say it's 175 micrograms. Other ways that we measure drugs is in units. So insulin is the most commonly recognized drug measured in units. This is known as a U100, which means there is 100 units for every milliliter. This is not a complete drug label. Now, insulin can also be U200, U300, or U500. It depends on the type of insulin. But insulin is measured in units. And in your textbook, there's actually an image of an insulin syringe. The syringes are special for insulin, and they are measured in units because the patient, it just makes dosing easy for the patient. Other things that are measured in units, nystatin, which is an antifungal. I'm going to just reference right here again. Humulin is a brand name. It is human insulin isophane, combination of human insulin and human insulin. This is a brand name. We've got the trademark. Nystatin, no trademark, no other names. It's a generic label. This one is 100,000 units per milliliter, and in the whole bottle, there's 475 milliliters. It's an oral suspension. We need to shake well before using. It's only available by prescription, so we're seeing a lot of information on that label. Heparin is another thing that's measured in units. This is a NTI drug. It's also considered to be a high-risk drug because if it's not dosed properly, it can cause potentially irreparable damage to the patient. We see here, this one is 10,000 units per milliliter. Over here, this one is only 10 units per milliliter. So there's a big difference. We do not want to get those mixed up. And penicillin's another thing. So penicillin G, we have, it's measured, this is going to be measured in international units. So not all penicillins are measured in units, but penicillin G is. So just some examples of drugs that are measured in units. Another type of measurement is a milli equivalent. I'll be honest, don't get freaked out over what is a milli equivalent. I'm not sure that nursing would take you into doing a milli equivalent conversion. Pharmacy, it's only in advanced pharmacy. It ties back into chemistry, so we're not going to worry so much about it. When you're actually doing math associated with dosing, we're going to end up canceling it out because when the doctor orders a drug in milli equivalents, it cancels itself out as a unit. So, potassium chloride, a lot of our electrolyte type drugs are measured with milli equivalents. So this is a liquid. It's 20 MEQs. That's the correct abbreviation. Lowercase m, uppercase e, lowercase q. There's 20 milli equivalents in 15 milliliters. Or this has already given us a conversion, but most often the doctor's not going to write in milligrams for potassium. Over here we've got the tablet formulation. This is Chlorcon. KCl is the chemistry abbreviation. So this is not a brand name. It's just a chemistry abbreviation for potassium chloride. We don't see any trademark symbol here, so that's not a brand name, even though it looks like there's two names on the label. We know this is a brand name because we got that trademark symbol. So Chlorcon 10 is a 10 MEQ potassium chloride extended release tablet. It is important when you're looking at tablets and capsules, they're not all created equally. You need to know if it's a tablet or an extended release tablet, if it's a capsule or an extended release capsule. Some drugs are measured as percentages. This happens a lot with our creams and ointments. This is a 2.5% hydrocortisone cream. The package holds 30 grams of cream or 1.1 ounces. There's going to be different strengths. So it could be a 10% hydrocortisone. You use that to help you make sure that you're selecting the correct medication. Over here we have some eye drops. This is an ophthalmic solution. Pataday. This has trademark instead of the copyright symbol. This is the brand name. Olapatadine is the generic name, and it's the 0.2% strength. So that just helps us know to pull the right strength from the cabinet. And the last type of alternate units for dosing medications include ratios. So some drugs, it's a comparison, parts to a certain amount. So epinephrine, this would be something that could be used in a code. We keep epi in the cart. This is a 1 to 10,000. So 1 part epinephrine to 10,000 parts of the liquid. And when we look at it, I'm saying that this is a 10 milliliter syringe. So the total in here is 1 milligram, and then it breaks it down to 0.1 milligram per milliliter. When they're packaged like this, they're often a single use. But occasionally we will have drugs that are in a ratio. If you're in pharmacy, we may be compounding drugs that are in a ratio. When you learn how to do the math part, that will become more important. Just know, again, it's just going to be, we need to look at which package are we pulling from the shelf. Does that dose match? Now, household doctors are still going to write things, especially in a community setting. So if you're working in a clinic or your patient is being discharged and you're going over their discharge with them on how to take their medication when they leave, teaspoons, tablespoons, ounces, and pounds are going to be the more common of the household measures that could show up on a prescription. We don't usually transcribe using these. We want the patient to use the proper medical device for measurement. But TSP means teaspoon, where TBSP or capital T would be tablespoon. Ounce is usually abbreviated OZ. Sometimes it says FLOZ if it's a fluid ounce. This ounce would be a weight, like there's 16 ounces to a pound. Now pound, LBS, or the pound sign, that signifies pound. Most patients know their weight in pounds. They don't know them in kilograms. So we'd have to do a conversion. So I want to point out, when somebody is told to take a teaspoon of maybe cough syrup, there's a big difference between your silverware drawer teaspoon and a measured teaspoon, because teaspoons that we use for baking, right? These look familiar maybe to some of you. These are calibrated. So they've been tested. We know exactly how much they hold scientifically. Your silverware does not. It can vary greatly in the size that the bowl in the spoon could hold. So it's important, if somebody is told to take a teaspoon, that we give them the appropriate measuring device to take home, whether it's a oral syringe or some kind of dose cup kind of thing. You guys try an experiment. Measure out 1 teaspoon or 1 tablespoon from your silverware drawer and pour it into a measurement teaspoon or tablespoon and see if it overflows or if it falls short. Just to kind of realize that, oh, yeah, we've got to be careful what we tell the patient, so we make sure they take the right amount. Now, I'm adding a couple of things here to the end because it's just some things I want to make sure that you're getting and understanding that maybe the book has not addressed completely. So just a couple of slides here. So the first one is things we cannot substitute. You cannot substitute a solution for a suspension or vice versa. So if the doctor writes for a solution, we have to give them a solution. If they write for a suspension, we have to give them a suspension. If the product that they're asking for is not available, we need to call them and get them to change the order. Same with ointments and creams. Again, ointments stick to the top of the skin. They could cause more absorption the longer that they sit on the skin. Creams going to absorb through the skin. They're water-based. They're going to break down more easily. And then eardrops for eye drops. Now, I did not put eye drops for eardrops. And this is not necessarily a substitution, but sometimes how doctors or prescribers will write an order. Eye drops are sterile. Eardrops are not, right? Your ear, you got some wax in there, maybe some dirt in there. It doesn't matter if you put something in there that's sterile or not sterile. Eye drops are sterile. You don't want to put something that's not sterile into your eye. So no ear drops in the eye. However, you can put your eye drops in your ear. And prior to going back maybe 5-10 years now, that was a lot more common. A lot of the same ingredients are used for eye infections and ear infections. So doctors used to write for eye drops and tell the patient use them in their ears. But because of insurance and billing and ICD-10 diagnostic codes, if it doesn't match 100% what the drug is supposed to be used for, the insurance company will usually deny it. But just so that you know, you can put eye drops in your ear. However, you cannot substitute ear drops for eye drops. And just going over labels again. So as I said before, it's really important to pay attention. Is it a regular release or is it an extended release? So here I have 2 labels for venlafaxine. And don't worry, the hydrochloride, they're both. Again, different manufacturers are going to put different information. This venlafaxine tablet, 75 milligrams. This venlafaxine is extended release capsule, but they are both 75 milligrams. So if somebody just wrote venlafaxine 75 milligrams, we can't fill that because it's not enough information. First, do you want a tablet or do you want a capsule? Now, tablets, they do have some extended release. So again, we need to know, is it a regular release or is it an extended release? So if one of your questions comes up and says, what is the dose form? Make sure you're paying attention. Is it just a regular capsule or is it an extended release capsule? Now here, again, same drug, different names. So here we have the venlafaxine extended release capsule, 75 milligrams, generic, right? Again, the hydrochloride part is just part of the drug name. There's no trademark or copyright or patent symbol here. But over here we have Effexor XR with that little trademark symbol and the generic name underneath. Every drug has a generic name, but not every drug has a brand name. There's no brand name on this left label. The right label has the brand name. Both the same. Now, if we could read this NDC number, again, it's pretty faded. The numbers aren't going to match. Just because it's the same drug, same dose, whatever, it's not going to match because they're not the same manufacturer. This is Zyders, I think is the correct, and this is Pfizer on the brand name. Now, one more. Same trade name, but different generic drugs. So you have to be thorough. You have to have great attention to detail as you're looking at labels. Think of them critically. But don't overthink. Don't go with the obvious. So when we look at this, we have Lotrimin antifungal. Lotrimin antifungal. That's the brand name, the trade name. But when you look for the generic name, this is miconazole and this is chlorotrimazole. They're both antifungals, but they're different drugs. Now, the other thing that's different here is the dose form. This is a powder and this is a cream. Other than that, it doesn't matter. Size of the container, that's not what we're looking for. We're looking for the obvious pieces. What's the same? Same brand name. What's different? Different generic drug. The powder is miconazole. The cream is clotrimazole. Don't overthink, but make sure that you're able to differentiate those key pieces. So, like I said, same drug, same trade name, different drugs, but they have different dose forms. And that often happens. They'll change the dose form. Earlier, I mentioned ranitidine. So ranitidine was available by the brand name Zantac. When they pulled ranitidine off the market and Zantac off the market, they lost name recognition. So the people who make famotidine, which is Pepcid, or somebody else, I'd actually have to go and see who the manufacturer is. But somebody is now using the name Zantac 360. That is actually famotidine. It's not ranitidine. Ranitidine, when it's available over the counter, used to be Zantac 75 and Zantac 150. So famotidine 360, like the whole circle, is Zantac 360, famotidine. All right, some questions, and you're done with lesson 2.